Hello, my name is Willie Posey. I am a physician here in Ark City, working at the specialty clinic at the Ark City Hospital as well as the Winfield Medical Arts Clinic. My primary area of medical focus is adult internal medicine and cardiology, although I am doing primary care as well, so I see children through adults in terms of medical practice. Now, I do want to talk to you about one issue that is close to my heart since I'm a cardiologist, and that is, what are the risk factors that put you at risk for having a heart attack, and what would be some of the signs that you could look for in terms of determining whether or not you have are having a heart attack. I say out the outset that if you are having chest pain symptoms that you are concerned about, whether or not they may fit the criteria that we outline generally for a heart attack, you need to see a physician or come to the emergency room, especially if you have risk factors for coronary disease. Now, what are those risk factors? And we've characterized them probably into 5 major ones. If you're a smoker, as compared to a peer of yours that is not smoker, you have an increased risk. If you have premature family history of heart disease, that is a family member, first degree usually, that is a father, a mother, brother, or sister who's had a heart attack before the age of 35, that's a first degree relative with premature heart disease, that's a risk factor. If you're hypertensive, especially if the blood pressure is not well controlled, that is a risk factor. If you have high cholesterol, that is a risk factor. And if you're diabetic, that definitely puts you at a high risk, as opposed to your cohort, that is age and same sex, in terms of increased risk for coronary disease. We know that men have an increased risk for coronary disease throughout the spectrum. Women have a little bit less risk of coronary disease until they become menopausal. Then their risk for coronary disease become equal to a man's at that point. Whether it is iatrogenic, which means that you've had surgery to remove your ovaries and had a hysterectomy, or if it's menopausal natural, your risk then becomes equal to that of a man's. And we can add a 6th to that, being stress. Especially type A personalities have an increased risk of having heart disease. Now, how does stress factor into this? Well, we know that high stress situations causes increase in catecholamine release, also causes increase in cortisol release. Those 2 hormones are stressor hormones. And if we had a constant state of readiness, is what those hormones are primarily helpful with, the fight and flight type situations that we're most commonly aware of. If we're in a constant state of that, then we have a significant effect on our end organs, heart, brain, and kidney. And because of that, stress can have an increased risk for us developing heart disease. And we see that primarily especially in the so-called developed countries, which may be also related to our diet and also what's going on around us in terms of our social situation. Excuse me. Now, heart disease in the different sexes. Generally, we know that there are what we call classic signs for coronary disease. That is, a person would come to me and they would say, "Doctor, I'm having chest pain." And my chest pain, and they will usually ball up their fist and put it in the center of their chest. "My chest pain is right here. I feel like someone is either squeezing me real hard, or they're pressing down, or elephant got his foot in my chest, and it won't go away." And associated with that, they're short of breath, they're heavily sweating, they feel very anxious, they may even feel real lightheaded. Those would be what we call the classic signs of a heart attack or angina. Unfortunately, diabetics may not have any of those signs. So they are a group of people that would be atypical in their presentation. They may only present with shortness of breath, or they may present with jaw pain, or they may not present with any kind of symptoms except they just don't feel bad. And we get an EKG and check their labs, and sure enough, they're having a heart attack. Women are also another group that tend to not want to follow the rules. I wonder why women are that way. Women may not have the typical symptoms. Some women will come in with just jaw pain or tooth pain as a sign of their heart attack. Now, don't get me wrong, a woman can have the classic signs. She can have the chest pressure, the chest tightness, the diaphoresis, the shortness of breath, all of the classic signs of a heart attack or angina. But generally, women can be atypical in their presentations. So women, if you feel symptoms that may be suggestive of having heart problems, don't sit at home thinking, no, this can't be, this is just heartburn. Come in and get checked. Because I can tell you the number, statistically, of the number of women who've had significant cardiac events and didn't realize that they were having them.
What are some of those symptoms?
Pardon me?
What are the symptoms that women should watch for?
Sure, yeah, the same kind of symptoms that men would have, except that they might just have jaw pain or tooth pain, or they may have an arm pain. Primarily, the arm pain would be in the middle, in the underarm area, but they may have those kind of symptoms and not have the chest tightness and the chest heaviness. They may feel anxious, they may feel short of breath. Those kinds of signs may be somewhat atypical.
Can back pain be associated with that?
Most definitely. And while we're talking about back pain, classically, angina came to describe any pain that was related to either chest or abdomen. So abdominal pain can be a sign that of heart disease as well. Some people have this epigastric pain, or what we call substernal pain, and it's located right in the epigastric region, but it radiates straight through to the back. Sometimes that can be a sign that you may have angina, but also could be a sign that you got either gastritis or a gallbladder disease. So that's why I'm saying, if you have a pain with those kinds of symptoms that very concerning to you, or if you have multiple risk factors for that, and we mentioned those at the beginning, that you need to get checked for that.